Welcome to our first podcast in the Wilderness Care podcast series. I'm your host, Linda Sanders, an emergency medicine doctor at the Medical College of Georgia at Augusta University and a wilderness medicine fellow. Today we're going to talk about blister care. This is a topic which I've become perhaps too acquainted with after working an ultramarathon in the Atacama Desert with some fellow wilderness medicine doctors last month. Let's talk about the importance of blisters and their relevance, their formation so that we can understand how to prevent them, go over some management strategies, and then review a simple blister kit. Blister care is relevant, and it's important. We've all had blisters before, so I don't have to belabor the fact that they hurt and they impair performance. With more people than ever competing in endurance sports like hiking and long-distance running, blister care is important to many of us. With more than 40,000 ultramarathon competitors this last year spending hundreds of miles on their feet, preventing and managing blisters is crucial to their success. My closest experience with blisters now comes from the Atacama Desert, where my friends and I got up close and personal with people's feet. And these are some of the feet that we saw. It's painful just to look at. Imagine daily marathons on these feet. To understand how to prevent blisters, we should know that blisters form from repeated sliding at a friction point. And what then develops is called a hot spot. Maybe just some local pain or redness. But this is when you should really act, because if it continues, the epidermis and dermis separate and a fluid-filled blister erupts. Luckily, we can prevent blisters by reducing the load that we carry, choosing proper foot care, shoes of appropriate width and fit so that they don't hit the toe box, and consider toe socks, which help reduce friction. Lubricants work better than antiperspirants to reduce friction, and pre-taping your feet with paper tape and taping any hot spots before they become blisters goes a long way. So to do this, what do you need? Well, it's really quite simple. Alcohol swabs, some safety pins or small gauge needles, scissors, gauze, and gloves if you've got them. Elasticon and paper tape are going to be your best friends for blister care. Additional items you might carry are second skin gel pads, a lighter, and adhesive spray. For starters, all you need to tape a hot spot is some paper tape. If you get blisters in certain problem areas, that's where you should put your paper tape. But sometimes, despite your best efforts, you get a blister. A closed blister still has a roof on it, like this one. In this case, use a sterilized safety pin that you sterilize with alcohol swabs or a lighter, or a clean needle to poke and drain the fluid. Then you can milk out the fluid, and sometimes this takes a couple of pokes. Once the fluid of the blister is drained, you can apply paper tape and then some adhesive if you've got it. If you don't have adhesive, just apply the Elasticon over the paper tape. I cannot emphasize this enough. Do not remove the tape daily. It will also remove your skin. Keep the blister tape on as long as you can. The management for an open blister is similar. Unroof any loose edges using a scissor. And if available, apply second skin to the blister. This comes in squares or circles. So as seen here, we've applied some second skin to this blister. Then we're going to apply the paper tape over that. And finally, some Elasticon tape as done previously. There are a few special situations with regards to blister taping that we should address. We're going to review toe, heel, and ball of the foot blister taping methods with some live video. All of these blisters will be drained using the previously described method. Blood blisters, on the other hand, should be left intact. These are deeper and higher risk for infection. Instead, simply apply paper tape and Elasticon over top of these blisters. Infected blisters will be pus-filled and may have surrounding redness, suggestive of cellulitis or a skin infection. In these cases, you should unroof the blister apply topical antibiotics such as bacitracin or neosporin, and even consider oral antibiotics. Our first video reviews toe taping. So if Zach had a blister at the top of his toe or underneath his toe, we can first drain that, as we discussed before, and then we can apply some paper tape around the toe. So just simply have some pre-cut paper tape here. You want to keep the edges as smooth as possible, which can be difficult in the toe region. And your first layer just goes around the toe like that. Then you really want to put a layer over top of the toe, and then one more layer around the toe. Actually, RJ, I'm going to just... Okay. And you can do this as a preventative strategy or for an active blister. One thing to keep in mind is never use elasticon on the toes because it rubs against the other toes and causes more friction. And here is your finished product. Our next video reviews heel cup taping. So similar management for a heel tape job. We would drain the blister, and then if he has a blister about here on the heel, the best way to make it stick is to use paper tape first to tape the area of the blister over the heel. So at this point, if you have an adhesive spray, this is a good time to spray down the tape so that the rest of it sticks. Now we're going to take this tape, place it around the back of Zach's heel as such, so that it pulls on both sides as far as you can, and keep things as smooth as possible. And then the bottom part is going to come around and up like a stirrup. And here you can see the heel cup tape job in the back. Lastly, ball of the foot blisters are really difficult to deal with. This is one that I did with a headlamp in the back of a tent. Okay, so if Zach had a blister on the ball of his foot over here, that's a pretty tough area to get to. So we're going to use same method as before. We're going to clean the area, sterilize our needle, poke it, drain the blister out, and then apply paper tape. So once you've applied the paper tape, really the next part of this is to apply your elasticon, which I've pre-cut into what we call an origami shape, so that this end goes on the blister, the middle part goes through the toes, and the other part goes on the top of the foot to hold it in place. And there you have it. There is your origami tape job for a ball of the foot blister. Just a quick summary of your blister management. Remember to leave the roof on if you can on closed blisters. Don't drain any bloody blisters. And unroof and give antibiotics for infected blisters. And lastly, here's another look at my suggestion for a blister kit. If you have any questions about blister care or other wilderness medicine issues or concerns, please email us at wildernesscare@gmail.com. I just want to give a special thanks to Zach Smith for providing his feet for the videos, as well as RJ Lau for videotaping, as well as my friends from Atacama, both the medical team for their photos and the competitors for their feet. Till next time, take care of your feet.